When patients first come in, sort of acutely, the things we look for are what their potassium is. So if the potassium is high, they're hyperkalemic. It often means we need to dialyse them as an emergency. So they're very fluid overloaded as well, having a lot of difficulty with breathing, can't lie flat, having trouble talking because they show sort of breath. It's another sign we need to start dialysis quite quickly. On their blood figures, if they're very acidotic, it's another sign, and also if they're showing signs of uremia as well, they're feeling sick, they're headachy, it's another sign that we need to start dialysis quickly. When patients first come in, their access is often temporary, so it may not be good as a permanent access. So often getting an adequate blood flow from that line is important. So it's getting the right position for the patient, making sure that they're comfortable, that we can get a sustained blood flow through their treatment. But also often their blood pressure can be quite unmanageable as well. Sort of can be very hypertensive, or they can have low blood pressure. So it's sort of closely monitoring their blood pressure when they are on dialysis and adjusting the fluid that we may be taking off on dialysis accordingly and getting them assessed. But also patients can be very anxious when they first start, when they come in as well. So it's reassuring them that, it is very new for them, this dialysis procedure, but, the machines are very, very safe and we're monitoring them closely. So, trying to put them at ease really during the whole process. The access that people have, obviously you need a line, one taking the blood out and another one returning it. So the red line takes the blood out, which follows the line up here. A lot of the different modules that you see are for different monitoring purposes. So this one tells us how much fluid we're taking off, and we can give us an idea of if we can take off more fluid or less. The blood comes up here to the blood pump, and we can change the blood flow accordingly to how much we want to process. The line here just gives us a reading of how easily the blood's coming out. As the blood goes along, there's a little air trap just to make sure that no air gets travelled into the line. Then it goes up into the dialyser here, so the filter is the bit that does all the work really. Blood goes down into all the individual fibres in the dialyser, and that's the process where the waste product is diffused out into the solutions that are at the side here. So there's a clean solution going through the other side of the dialyser, and all the extra fluid and the potassium and phosphate and things we want to get rid of are diffused across. Then the clean blood comes down the other side into the chamber here, which is the air chamber. So any air or clots that may be detected or formed in the line will be detected there. Obviously we don't want any air or clots to go into the patient, so if they are, it automatically clamps here, so it's a safety mechanism that's inbuilt into the machine. And once it's all fine, basically it goes straight back into the patient. It's just a continuous process throughout. So as the blood comes out, the blood goes back in. Normally when patients first come, we would dialyse them for short hours every day to begin with, so maybe just 2 hours to begin with for the first session, 2 hours the next day, according how much fluid we need to take off. That would obviously be assessed in the morning, and then we'd dialyse them afterwards. But it's short sessions every day to begin with until they either recover and don't need any more dialysis, or they may progress and need more permanent dialysis, so 3 times a week. But to begin with, it's just short and gentle to start.